Thank you, Madam Chair and members. I am here to present SB 1016, which will help uncover trends and disparities that are often hidden in aggregated health data for Latinos and Indigenous Mesoamericans. Latinos make up 40% of the good state of California's population. However, within the Latino community, there are several ethnic groups that have diverse health outcomes. These distinctions hide in the monolithic term of Latino, which leads to less detailed and nuanced health information. SB 1016 will address these shortcomings by requiring the Department of Public Health and the Department of Social Services to collect and release disaggregated data for specified Latino subgroups, including Mexican, Salvadoran, Guatemalan, each major Mesoamerican indigenous nation, and others, similar to what we've done to the API community. Testifying in support of this measure today, I have Mar Velez with the Latino Coalition for a Healthy California, and Antonia with Comunidades Indígenas en Liderazgo, Cielo. I respectfully ask for an aye vote on SB 1016.
Thank you so much. We'll now move to our lead witnesses in support. We will hear from each of you for 2 minutes each. And please state your name. And when you're ready, please go.
Good afternoon, Chair and members of the committee. My name is Mar Velez, Director of Policy with the Latino Coalition for a Healthy California. The U.S. Census Bureau recently reported that over 1 in 4 Americans are likely to be Latino by 2060. With our growing population, it is critical that California, the state with the largest Latino population at 40%, understand the diversity and specific health needs of our community. This is why LCHC is a proud co-sponsor of SB 1016, authored by Senator Elena Gonzalez, which will collect and disaggregate anonymous demographic and language data for Latinx subgroups and indigenous Mesoamerican nations in California. The goal of SB 1016 is to uncover and reduce underlying health disparities, both clinical and those related to social determinants of health, such as housing, for Latino and indigenous nations in California. Research shows that more specific, high-quality demographic data is beneficial to address and effectively meet the health needs of diverse populations. Latinos are more likely to have multiple underlying chronic conditions like asthma and diabetes. More specific data could allow public health departments and health systems to provide culturally competent and responsive care and information to address these disparities. California must also start collecting specific data for indigenous Mesoamerican nations in California who do not identify as Latino and who speak more than 560 languages. During the pandemic, indigenous Mesoamericans were also disproportionately impacted, as many are essential workers, such as farm workers, but face language barriers to access timely and reliable health information on COVID and on life-saving vaccines. SB 1016 will collect data on Mesoamerican indigenous languages, which will assist in increasing equitable access and utilization of healthcare programs and social services like CalFresh. SB 1016 highlights and brings awareness to our unique and diverse differences and ensures health equity for Indigenous and Latinx across California. I respectfully ask for your aye vote for SB 1016. And my colleague, Antonia, will provide her testimony in Spanish, and I can interpret.
Claro que sí. Muchas gracias por estar aquí. Thank you for being here. Empieza cuando está listo.
Kaya kung siya ikchalak konohel rimpi Alton Velázquez nak ashal sirch pangwendi malak tilmitri. Kimpiti kuk hakpuk winak kipi cielo. Buenas tardes, buenas tardes, miembros del comité. Mi nombre es Antonia Velázquez Maya Quiché, intérprete del idioma quiché de Comunidades Indígenas en Liderazgo, también conocido como Cielo, basada en Los Ángeles, California, que aboga por el derecho lingüístico para indígenas emigrantes en California y en todo Estados Unidos. Cielo es un orgullo copatrocinador de la SB1016, escrita por la senadora Elena González. Tener datos demográficos específicos y de la alta calidad es vital satisfacer las necesidades de salud de la población indígena en California, quienes contribuyen a la economía de nuestro estado. Yo he interpretado situaciones en donde mamás tienen miedo de aplicar para CalFresh porque creen que pueden ser carga pública y que sus hijos lo paguen después cuando sean mayores de edad, porque no han obtenido la información correcta en sus idiomas maternas. Nosotros tenemos el derecho de pedir información y un intérprete en nuestro idioma son derechos humanos. También vimos la consecuencia de no tener información en nuestros idiomas durante la pandemia del COVID-19. Como respuesta, Cielo inició a recopilar datos que confirman los 17 idiomas indígenas habladas y viven en Los Ángeles, en el condado de Los Ángeles, California. Esta información nos permite entrar el mejor servicio a la comunidad indígena. Por último, no se puede asumir que todos los que viven del sur de la frontera hablan español o que todos son latinos porque borran la comunidad indígena. Si no existimos en números, no existimos en absoluto. Respetuosamente le pido su voto a favor de la SB1016. Muchas gracias.
So good afternoon, members of the committee. My name is Antonia Velázquez, Maya Quiché interpreter of the Quiché language from Comunidades Indígenas en Liderazgo, also known as Cielo, based in Los Angeles, that advocates for linguistic rights for indigenous migrants in California and throughout the United States. Cielo is a proud co-sponsor of SB 1016, authored by Senator Elena Gonzalez. Having specific high-quality demographic data is vital to meeting the health needs of indigenous populations in California, who contribute to our state's economy. I have interpreted situations where mothers are afraid to apply for CalFresh because they believe they may be a public charge and that their children will pay the consequences later because they do not obtain the correct information in their native languages. We have the right to request information and an interpreter in our language. They are human rights. We also saw the consequences of not having information in our languages during the COVID-19 pandemic. In response, Cielo began collecting data which confirmed 17 indigenous languages spoken and living in Los Angeles County. This information allowed us to deliver the best service to indigenous communities. Lastly, you cannot assume that everyone who comes from south of the border speaks Spanish or that everyone is Latino because it erases indigenous communities. If we do not exist in numbers, we do not exist at all. I respectfully ask for your aye vote for SB 1016.
Thank you so much. We'll now hear from members of the public wishing to express their support for this bill. Please come to the microphone, state your name, affiliation, and position only, please.
Rebecca Gonzalez with the Western Center on Law and Poverty in strong support of this bill. Thank you.
Thank you.
Johnny Pineda on behalf of the Latino Coalition for a Healthy California and more than 40 nonprofit organizations in support of SB 1016. Thank you.
Thank you.
Good afternoon, Jared Call with Nourish California in strong support.
Thank you.
Susanna Niffen with Children Now in support.
Thank you.
Jennifer Snyder with Capital Advocacy on behalf of the California Life Sciences in support.
Thank you.
Christopher Sanchez with the Mesa Verde Group on behalf of the Coalition of California Welfare Rights Organizations.
Thank you.
Yasmin Pellet on behalf of Justice and Aging in support. Thank you.
Thank you so much.